This is Urban Health Today, and I'm speaking with Dr. Lauren Powell, Head of Health Equity at Biogen. She's here to talk about lupus, an autoimmune disease that disproportionately impacts women and individuals from Black or African American communities, and offer insights on the current challenges and key opportunities for advancing health equity in lupus diagnosis, management, and research. Thanks for being here today, Dr. Powell. Welcome back.
Thank you. Thank you so much for having me. It's my pleasure.
It's good to have you again and sharing your knowledge. All right, let's get started. Um, Please talk about your background and your work with Biogen.
Absolutely. Well, again, it's my pleasure to be here. Thank you for the invitation. Um, I am excited. I've been at Biogen for almost a year and a half now. I'm head of health equity and drug development in particular. My background is in public health, population health. I've worked in federal and state government, all with the purpose of working to advance health equity. So you could say I am rather obsessed with health equity. I think about it all the time. And I'm excited to be here at Biogen where we're applying health equity in a different way, specifically to the drug development process, which is different than the way I kind of think the rest of the industry has thought about health equity. We think about, this intersection of both COVID and the murder of George Floyd, in which health equity became really front and center across the country, but really also very much in this the pharma and biotech industry. What a lot of folks tended to focus on then was diversifying clinical trials, which we still have a lot of work to do as an industry on, right? That's
Right.
very important. But that's not the only thing we should be doing. And so I'm so excited about this role because I am actively applying health equity to our entire drug development process. So ideally, that should help enable us to diversify clinical trials if we start thinking about health equity much earlier, much further upstream in the drug development process. So that is some of the work that I'm doing. I'm excited to share so much more, especially from the perspective of lupus.
So, what does drug development from the front end in your position, what does that look like?
hmm That means thinking about our decision making, thinking about how we make decisions, how we are ensuring that our decisions are informed by the patients with the most unmet need, the patients who are disproportionately impacted by the disease areas that we focus on. From my experience working in public health, working in the community a lot and doing a lot of community engagement, I found that I think there's an opportunity in this industry for us to be much more community engaged, and we would say patient and engaged, but I also think more community engaged throughout the entire drug development process. So that
Mhm.
means really ensuring that our inclusion exclusion criteria, for example, aren't going to perhaps unintendedly or unintentionally, I'll say, um, weed out the patients that we really want to be able to be a part of our clinical trials. So this also means that we really have to take into account the endpoints that we're, studying, and ensuring that they are informed by a patient population who is most burdened by disease, and that our protocols that we're thinking about balancing scientific rigor, of course, with protocols, with the fact though that we are asking people to participate in them, right? And that there has to be a balance between the burden that it takes to participate in a trial and also the scientific rigor that it takes to fully develop a drug.
That sounds very comprehensive, Dr. Powell. Well, speaking of disease, why does lupus disproportionately affect Black and African American women at such high rates? What are the underlying factors driving this higher prevalence?
Yeah, it's a fantastic question, and we do know that research does show that lupus prevalence is 3 times higher in Black or African American people, and they're at greater risk of earlier onset of lupus and more aggressive disease progression than white people. We do also know that lupus is one of the top 10 causes of death in Black or African American women between the ages of 15 and 44 years old.
Oh, wow.
Yes. So it's extremely compelling. It's extremely disturbing too. And I should also say that my mom has lupus. My
Oh,
mom and I have also a cousin who has lupus as well. And my mom was diagnosed with lupus when I was in high school, and so this really, has very significant meaning. This work has significant meaning to me, and understanding this disease, I have like real life experience, like navigating
well,
this disease. And so I think there are a couple of factors. I think one, we continue to do this work. It is so important for us at Biogen, because we really do want to meet the needs of unmet patient needs. And this is a significant unmet patient need. But I think one, I'm not sure that there's been enough research historically that has included Black women. And as in many other disease areas, right, there have not always been the most intentional ways of including and making sure that Black women were a part of just sort of even natural history uh, projects and even registries, right? And I'm glad to see the Lupus Foundation of America and others really working very intentionally at that. I think second, the experience of navigating the healthcare system as a Black woman is very different. As a Black person, as a Black woman in America is very different. And um, having to contend with advocating for yourself, standing up for yourself, and really ensuring the healthcare providers take your symptoms seriously. There's plenty of research that shows that um, we still have issues with bias and we still have issues with racism in medicine, that Black women are less likely to be taken seriously about their pain, about the discomfort that they experience. And so that also in the odyssey, just of this being a very tricky and complex disease, makes it hard to diagnose, period, but even harder maybe to diagnose if you're a Black woman, right? Navigating the healthcare system. Um, and when I think about when my mom was diagnosed, she was diagnosed in a full-on flare. We had no idea what was going on. She woke up one morning and really couldn't move at all.
Oh, wow.
Um, yeah, and so when we talk about like disease progression and the severity of disease, that's really what we mean. Is like it's not sort of these sort of very light symptoms all the time. Sometimes it's literally a feeling of crisis.
Well, I'm really sorry to hear that about your mom and your cousin. Does the disease does it present differently in Black women? Is that why, does that have anything to do with why diagnosis is lower?
Well, I think that there's still lots of work that I think we continue to be interested in around biomarkers, and these are the types of indications that could help us really better understand that. I can't say that I know that I have an answer to that in particular, scientifically,
Hmm.
but I can say that I think that the patterns of accessing the healthcare system are different for Black women. I think the way, again, that Black women are treated when they do access the healthcare system also makes a difference. And I think some of the scientific rigor that we still have to sort of uncover, and we still have to do to uncover, um, the ability to better early detect this disease is something that we're very much interested in and continue to be committed to. Um, the last thing I'll say is just, in order to really get out, I think about my mom's case in particular, in order to actually get diagnosed, like she really needed to be referred to a specialist, right? The
Right.
first point of care is a primary care physician. There's still a lot of awareness to be made around this disease for primary care physicians, but then you also have to be referred, and that is not always an easy process. So I really think that uh, systemically and systematically within the healthcare system, there are challenges for Black women in particular in getting diagnosed, but there's also still the need to raise awareness about this disease amongst healthcare providers in general, especially primary care providers who are often the first line of defense.
Yeah, I only asked because I know I spoke to somebody recently and we talked about skin diseases, how they present differently in skin of color, and so diagnosis is different for skin of color. Has been a challenge for skin of color. That was what made me think of that. Um,
And I do completely agree with that. I completely agree, and I think that underscores again changes that have to happen within how healthcare providers are trained, right? That
mhm.
manifestations of like the lupus rash look different on Black skin, on very dark skin, on skin that is not white, and that's often what's only in textbooks. That I have spoken with some physicians who, some of our KMEs or our partners who talk about the differences and that, like, Black women, the manifestations can be skin, it could be hair loss is a really big one that I don't know if it manifests the same way in white women. And so I think there's much more research and care that has to be paid attention to this disease, especially in Black women.
Yeah. What does more aggressive disease progression look like for patients and their families in Black communities?
Mhm. Yeah, it's a great question, and again, from my own personal experience, although my mom is in fantastic health, we're very blessed, and her lupus is very well controlled. But
Mhm.
it can mean, frequent doctor visits. It can mean, a heavy burden of caregiving. It can mean really having to help someone with day to day activities, especially in a lupus flare. It can mean significant fatigue for patients, to the point that it's hard to really do a lot to function at all. And some of our um, patient advisory boards and some of the times that we have spoken directly with patients, that was like the number one thing that they shared, was fatigue and really feeling very very tired. And then a lupus flare, um, which is kind of when there's significant like pain in the joints and swelling and um, you know this is SLE in particular we're speaking of, and
Mhm.
CLE is the skin manifestation, but it can be very painful. And I think that's something I don't think we should miss, that the pain can be systemic, right? It can be all consuming. And so um, more progressive, or more severe disease progression really looks like that.
What are the most significant barriers preventing early diagnosis and treatment of lupus in urban communities, particularly for Black women?
Yeah, it's a great question. I think this is something we're working on actively right now, is disease awareness. I think folks have to know um, that this disease exists, and it's actually interesting because I think a lot of Black women do know. In the times that I have been out in the community and
Wow.
we mention we work on lupus, they're like, "Oh, I have somebody, I know somebody in my church, or my sister, my cousin has lupus," and so. Um, that doesn't mean everyone knows, right? And we have to do much more work to continue to raise awareness about the disease. But I think we also have to get much more creative about how we share health information. One of the ways that we are going to be piloting that and working on that is showing up in culturally um, appropriate events, and in events where people from different cultures, from community events, where folks are already going for something else. They're going because they're interested in something else. But is it possible that we could share healthcare information there too? In about a month, we are going to the Essence Festival
Wow.
in New Orleans, and we will be there and working with our partners at the National Medical Association um, to advance disease awareness. And so we will be there on the ground. Now, people aren't coming necessarily to hear about lupus, right? But Essence draws nearly 500,000 predominantly Black women
Right.
who are there for a cultural festival, right? But can we enter a cultural festival in a way that honors cultural humility and that honors the community who will be there, and also share some potentially life-saving healthcare information as well, information about lupus. And so we are exploring that. We're exploring also partnering with the Lupus Foundation of America, who I understand will also be there, but really meeting people on the ground to share more information about this disease. The other thing is, so it's getting the message out, we could say that. The other thing is also, who is the messenger? Sometimes it's not always the best for us to be the messenger, and that's okay. That we can work with other partners who have a different type of relationship with the communities that we wish to serve and to support, and that they can be the messenger. So we are working with the National Medical Association. We're looking at potentially leveraging influencers in the future, recognizing how many patients get their information from digital sources and digital influencers now as well, and how we can leverage that too.
You're gonna laugh. Well, don't laugh. But I remember my first encounter with a Black woman having lupus was I used to watch Braxton Family Values, and
Yes,
Tony
Tony
Braxton.
Braxton has lupus. Yes.
Right. And
Mhm,
so that was what put lupus on my radar,
mhm,
many years ago. I don't know if that had the same effect for other Black women, but for me, that was, my first like, oh wow, I didn't know this was a disease that Black
mhm.
women got. So anyway, I
Absolutely. No,
digress. but
That stuck with me too, and it continues to stick with me, and that's why I say, like, there are other folks who can reach audiences that we will not reach in the traditional ways that information is shared, has been shared through this industry.
how do social determinants of health intersect with lupus outcomes in urban settings?
Yeah. The social determinants of health, I feel like, should never be underestimated. I think, let's first talk about what that is. The social determinants of health are everything outside of the 15 to 20 minutes you may spend with a healthcare provider on occasion, if you are a healthy person. And that includes everything from housing, food insecurity, to the neighborhood you live in, to your access to transportation. There's even evidence and research now that underscores how much information and digital access to digital information is also a part of the social determinants, and access to information, be it truthful or misinformation, is also a social determinant of health. So when we think about that and how it intersects with lupus outcomes, specifically in urban settings, well, it's important. Number one, we can start with information. Let's start there. So much of our society is moving towards, reliance on digital sources. There are
Right.
remote clinical trials now, right? Like, everything relies on the use of.
Really?
There are, yes, there are. Absolutely, yeah. And that was a really big thing during COVID, in fact,
Huh.
to be able to continue to do trials. Yeah, there are lots of other artificial intelligence, right? So much is happening with
Hmm.
technology. That's great. However, there are still a significant number of households in urban communities as well that do not have access to the internet. That maybe if they do have access to the internet, it's sporadic, right? That don't have Wi-Fi at home, don't have unlimited digital plans on their and data plans on their phones.
Right.
Um, Still using flip phones in some places. So it's important for us to realize that if if information is only shared digitally, there's a lot of people in urban settings as well who will be left out. And so, what does that mean around raising disease awareness, encouraging folks to see a doctor if they're experiencing certain symptoms around lupus? That means that there are a significant number of people we're still missing with messaging, which underscores why as I just shared with you about us going to Essence, it's
Mm.
important that we be face to face sometimes in communities, because you can't fully rely only on a message going out digitally.
Out of curiosity, I want to circle back for a second, if you don't mind. You touched briefly on PCPs, primary care physicians, that should refer out. What should primary care physicians look for, or what symptoms should they be listening for, um, when they encounter patients to say, okay, I need to refer you out to a specialist?
Yeah, I will start by saying I'm not a medical doctor, but I think some of the symptoms that, um, from the time we have spent, especially with the National Medical Association, the symptoms that they really talk a lot about are like hair thinning, hair loss, um, changes in skin. So there are two forms of lupus: a systemic lupus, which is SLE, and cutaneous lupus, which attacks more of the skin. So changes in your skin, things you might think are like a sunburn or something in your skin. There is a particular sort of rash that's along the face. It sort of looks like a butterfly, and that is also can be a symptom of lupus. Extreme fatigue. I think, we live in a very overstimulated society, and sometimes people say they're tired, and it's just like, yeah, like everybody's tired. But um, the fatigue we're talking about here is very different. And I think anytime someone says they're tired, I think that has to be taken pretty seriously. And then joint pain. So there can be pain in the joints, swelling sometimes in the joints as well. Um, I think those are some of the symptoms that the physicians that we work with, really underscores being something to take seriously.
What role would you say implicit bias in healthcare plays, in lupus diagnosis and treatment disparity?
Yeah, I think implicit bias. I don't think that we can talk about anything in this in the healthcare system without acknowledging the impacts of bias, the impacts of differential treatment when trying to seek healthcare. and the impact that that has on health outcomes. If I'm presenting to a physician and I'm in severe pain, but I'm not taken as seriously, my pain is not taken as seriously because there's still an underlying notion that Black people in this country can withstand pain and have a higher pain tolerance than white people. And that is actually a founded researched fact. There is a
Right.
study that points to that that actually came out, I think, in 2016, 2015.
Oh,
And if if I'm presenting in pain and I'm not being taken seriously, like that's prolonging my potential diagnosis, right? If I have to continue to come back, it's also impacting my quality of life. Like I don't pain is not something to just be brushed off, right? That impacts quality of life. That impacts the ability to actually be fully diagnosed, to have to come back and forth to the healthcare system multiple times, to be taken seriously, to have to find a different provider sometimes to be taken seriously. And then the cost of that, right? We think about the cost of that too for patients who are just trying to get the best care that they deserve.
I can easily see a provider, like if someone says, well, I'm really tired and they're presenting with fatigue, a provider saying, well, you work a particular kind of job, so that makes sense. As opposed to, well, let's look deeper into this and see what, the underlying causes can be. So I was just, wondering about, what that would look like in terms of getting diagnosed. I can see challenges with that right off the bat. Um,
Significant challenge, yeah, significant challenges with that, and think about, you know, what that means for your trust then in continuing to rely on the healthcare system and continuing to rely then on tests that are performed, or the um, the hope and belief that you're receiving the best care possible, and that feeds into and also touches the work that we do in drug development, right? And like clinical trials and participating a part of being a part of clinical trials is a part of the care continuum. And so if you don't trust that you're having a good experience with any provider that you're working with throughout, potential disease diagnosis, that makes it even more difficult to present the opportunity to be a part of a clinical trial and possibly be a part of a developing a drug that's transformative.
how can healthcare systems and providers better support Black women who are navigating a lupus diagnosis and long-term management?
Yeah. Well, I think providers can, number one, believe Black women, believe that we know our bodies, believe that we pay attention to when things feel different and feel off. That if we say it one time, then we mean it, and it should be taken with all credibility and seriousness. So I think that's the number one thing. I think we can also you know consistently consider all of the latest therapies and treatments that are available. One of the other ways that I think about health inequities persisting in Black communities is not always having access to cutting edge treatment.
Right.
So, right, and not being providers not always thinking about the first cutting edge treatment for their Black and brown patients immediately, like coming to mind. That also means though that the providers have to know about all of the cutting edge treatments that are out here, and so the onus is somewhat on the rest of the health ecosystem to make sure that, again, information is flowing out to rural areas, to urban areas, to community health centers, to federally qualified health centers, so that the physicians and healthcare providers do know about all the latest and cutting edge treatments that are coming. But then it's also the onus is on the providers to make sure that they are sharing that with their patients. When we think about that in the context of lupus, over the last 6 decades, only 3 drugs to treat lupus have been approved in the U.S.
Oh, wow.
Yeah, so and that's a long time. That is a long time for a patient segment and a patient population to go without any additional treatments or options. But there have been some recent breakthroughs that have created much needed momentum and um, identification of autoantibodies and opening up promising new pathways to research and development. And we're working to deliver the industry's first lupus franchise, addressing different forms of lupus, such as SLE, so systemic lupus, and cutaneous lupus, and we have and with some multiple ongoing trials. So, um, I think that our job is to continue to do our best to try to create therapies for patients. I think providers, it's providers' jobs. It's our job also to help make sure providers know about when we do have things come to market, that we're sharing that with providers, um, and then also to make sure though that the providers know that you have to share this with your patients, right? And we don't cherry pick, we don't pick and choose who we share information with. We share it with everyone. Um, yeah,
That's a tough one, though,
yeah,
because
it is.
I've heard providers say that they will recommend treatment based on what they think the insurance will pay for. So if they don't think the insurance is going to pay for something, they don't even bring it up.
Yeah. And I mean, this is where to truly address health inequities, it has to be a whole system approach, right? I think each of us are trying to do the best that we can, but I
Mhm.
think we all have to continue to work hard at that together. Yeah.
So how are you delivering the message to how are you raising awareness among providers of
Hmm.
treatment options?
Yeah. Well, we in our medical teams, we continue to work really hard with our MSLs, our medical science liaisons, and ensuring that one, our messaging is tailored and appropriate. Where we've got messaging translated into Spanish and English, and when we go out into the communities, making sure that we're sharing that. Sometimes we have physicians come up and want some of the information that we're sharing, and so I think that's important as well as sharing it with the community. Continue to build relationships though with healthcare providers who work in the margins of our society. I'm so excited that we have um, a, a great partnership that we have just begun and continuing to grow with the National Medical Association, who represents they are the largest membership body of the more than 40,000 plus Black physicians in the United States, and they are working very closely with the very patients that we are trying to connect with and trying to support. I think that's important. I also think diversifying um, how we communicate with providers and how we interact with providers is really important. So making sure that maybe we're thinking outside of the box about how we identify things like key opinion leaders, and bringing different voices, different HCP voices into the fold so they can share with us their experience from working in a federally qualified health center, a community health center, a private practice, and all the different ways that that should be informing our decision making here too.
What message would you want to share with those suffering from lupus about advocacy or self-advocacy?
Hmm. Well, one, I would want to share with them that they're not alone. I think it's important to know that you're not alone. That there are organizations such as Biogen who care, who are working and trying to bring some relief to the severity and challenges that this disease provides. Um, I think when it comes to advocacy, um, one, you know your body, right? Know exactly what feels normal, what doesn't feel normal. I think we have to push sometimes and continue to push and do our research as well on symptoms, on what's on latest breaking treatments. So many of our patients in lots of different disease areas, are the biggest advocates for themselves. They're the biggest advocates for their disease and condition, and ultimately they know that like they're more than the disease that they have. And I think folks with lupus know that as well. I would also say about self advocacy that there are multiple ways to advocate, right? And there are multiple avenues to advocate through, and there are certainly patient advocacy organizations, and that's one way. And certainly we at Biogen love to hear from patients as well. Um, but I also found it interesting to learn that there is actually a lupus caucus in Congress, and so
Oh, wow.
there are also ways to advocate through the legislature, and so I think there's self advocacy in the patient room, and then there's advocacy on different levels. that can change the way that this disease is even considered, across the country. So um, that's really empowering. And I hope that lupus patients know that they do have so much power, really, really do.
Dr. Lauren Powell, thanks so much again for your knowledge and your work in the equity space. And just, you're amazing. Thank you so much.
You. Thank you.